Dr. Evan Chait, Kinetic Rehab and Spine. Welcome to our channel. Click the link below to subscribe, share, and like our videos. Join today, join the movement, gain access to insiders' education on how you become a better you. Welcome to your destination of health and wellness. All the best. Sempre Avante. Always forward.
Hey everybody, my name is Tracy Lanzalotti. I am a licensed massage therapist at Kinetic Rehab and Spine. I'm also a certified personal trainer and certified animal flow instructor for level 1. I've also been practicing martial arts, Chinese martial arts, Bagua, over 10 years now. And I'm also handle the social media aspect for Kinetic Rehab and Spine. So I'm here today with Dr. Matt Fellner and Dr. Evan Chait. Dr. Matt Fellner is a doctor of Acupuncture and Chinese Medicine. He's also a practitioner of Bagua Zhang for over 25 years. An amazing instructor, actually led my first intro class. So I've known him for a very long time. And although his size may be intimidating, his heart is like the purest I've ever seen. So he honestly cares about your health, your well-being, and has amazing education, knowledge, and skill to help you get to where you want to be. So with further ado, I will now introduce Dr. Evan Chait. He is also a licensed acupuncturist, physical therapist, nutritionist, biohacker, which you'll learn more about during the session. And he is also the co-founder and CEO of Kinetic Rehab and Spine, where we all live our lives almost every single day. And his mission is to help as many people, millions of people as possible, and he's well on his way, and I'm happy to be behind him with that mission. So we'll start out with Dr. Fellner. What is the immune system in Chinese medicine?
The immune system, as far as the way we look at it in Chinese medicine, it's not entirely different from the way that we would view it in Western medicine. We use different terminology, and we're using sort of the knowledge base that was established thousands of years ago. So there's a lot of intuitive understanding of the body and the way it connects to nature. But on the most basic level, it represents a balance between the internal state of the body, or the internal terrain of the body, or environment, if you want to call it that, and what happens from the outside. Okay, so if the Chinese view of immunity would be a healthy, balanced environment within that can withstand or fight any invasion, so to speak, that would come from the outside. So that sounds very much like, you know, fighting infections and viruses and bacteria, and that is what is a big part of the immunity. And there certainly was a lot of infectious disease, you know, hundreds and thousands of years ago, and they dealt with very severe ones. So the state of the immunity is not necessarily that it has to always be so strong, because as we see today, a lot of people have autoimmune diseases or hyper reactive immune systems. So the Chinese always express the need for balance, the balance between the internal environment. So it needs to be strong, and the blood flow needs to be good, and the energetics of the body need to be good. The organs need to be strong so that it can fight off anything that would come from the outside. So there are diseases that, or let's say viruses and bacteria, especially, you know, relevant in this time of COVID, that are strong. All right. But if the body is strong, then it can fight it off. If it doesn't have any chronic long-term illness or inflammation that it's dealing with, then it can fight it off. And that's really the essence of the Chinese medicine, is making sure that there's a balance between that terrain, that environment that allows you to be healthy and balanced, and then whatever is an environmental toxin or a pollutant or a virus or a bacteria that could invade or cause a problem. So it's actually quite a bit of overlap. It's very similar. And that's where we work, is within that environment of the body.
Dr. Evan. So I just have to side note, Dr. Evan, if you haven't met him yet, his energy is very infectious, and he has this incredible way of looking at the body and the systems, and he's not afraid to be outside of the box where everyone kind of stays in line. So some of the things you may have heard before, but the way that he views things is just very unique, and honestly I've learned so much even in the short time that I've been here. So with that being said, please share with us how you view how nutrition affects one's immune system.
First and foremost, Dr. Matt, I've always been a big fan of yours. And Tracy, I wouldn't be able to live my life and run my business without your support. And I just appreciate you guys so much from the bottom of my heart. Thank you so much. I'm just going to piggyback on what Dr. Matt was talking about. And I love the fact that he talked about terrain. And because we believe that the number one cause of disease is, it's not what I believe, it's what Dr. Hans Selye found. He was an endocrinologist back in the 50s and 60s, that stress is the number one cause of disease in mankind. And he termed it general adaptation disorder or syndrome. And also short is GAS, which I thought was really funny as well. When the body gets into a stress response, it produces certain hormones, right? But the terrain of the body is extremely important, like Dr. Matt was talking about. And we look at stress as two components. We have traumatic stressors, which is physical trauma and emotional trauma. But then we also have terrain stressors, which Dr. Matt was alluding to. In our clinics, we look at terrain stressors being our digestive system, predominantly, right? In Germany, they've talked about the terrain of the body for a long period of time. And there's a whole entire school in Chinese medicine called the Earth School, where they believe that digestion is the most important aspect of someone's immune system, someone's health, someone's vitality and longevity. And what they're finding now with current research is that our digestive system is completely linked, especially our small intestine, to not only immune function, but also linked to hundreds of different other diseases. And there's something known as non-celiac gluten or wheat sensitivity that's contributing to weakened immune systems. So you don't have to have celiac disease to be affected by eating anything that has gluten in it, like wheat, pasta, corn, wheat, rye, barley, oats, and cow dairy typically are the most common offenders to weaken people's immune system, right? Because it causes something known as leaky gut. When we eat those foods, a molecule is produced called zonulin. And whenever we have gluten or wheat in our diet, zonulin causes these tight junctions in our gut. They look like this to open up and dilate. So then food stuff actually passes through these tight junctions, enters the bloodstream, and like Dr. Matt was talking about, it creates an inflammatory response. The body sees that as a foreign invader. And what they're finding now is that leaky gut syndrome is extremely prevalent because 100% of human beings cannot digest gluten. They've done studies in Harvard and found that they put gluten in a dish and they added hydrochloric acid to the gluten and it didn't break it down. So it's very difficult for us to digest gluten as a society. So I think there's two primary foods that contribute to a weakened immune system. And I'm sure Matt's going to go into other things later, but that's sugar and it's gluten. And there's a specific reason why I believe most people get sick from October to January. Yeah, it might be weather changes, but Matt's probably going to talk about this later. As human beings, we've adapted to cold climates for thousands, if not millions of years, especially as fair-skinned people. I mean, our ancestors are from colder climates, hence why our skin is so fair. We didn't need the sun as much. So with that being said, we cannot digest gluten, and sugar weakens the immune system. And from October to Christmas, what happens? October, you got Halloween. So people are pigging out. They're having a lot of sugar, right? And then what's next is Thanksgiving. What do you eat at Thanksgiving? You have stuffing that has loaded full of carbohydrates. Then you have your desserts. And then what's next? Christmas. And what's New Year's. So it just happens to be that the time that people get most colds and flus is also during the season where we pig out the most. It's also during the season we're eating more gluten, eating more sugars, right? Foods that our bodies cannot really adapt and handle very well.
Yeah, and just really quick, if I could just piggyback off that, because when we look at the Chinese medicine, we look at the two main organ systems involved with immunity would be respiratory, which makes a lot of sense, the lungs, because it's direct connection to the environment through breathing, and also interestingly enough, that's related most closely to the skin in Chinese medicine. So our protective mechanisms, filtering and and from outside environment come through the respiratory system, but probably the deeper level issues come from digestive issues in terms of Chinese medicine, what we call spleen qi deficiency. Now, spleen is a very awkward term. It's a translation issue from Chinese medicine, but what they're actually referring to is the entire system of digestion, including pancreatic enzymes, including the intestines, as you mentioned, Dr. Evan, the small intestine, and the issues that come from leaky gut based on sugary diets, and gluten affect that spleen qi, what the Chinese call dampness and spleen qi deficiency. Is a direct cause of improper dietary habits, and two of the main causes would be excessive sugar in the diet and excessive gluten, so pasta products and breads and things like that. So again, that's something that they were able to correlate many years ago, thousands of years ago, and now we're seeing the science a little bit more direct, in terms of the research, and we can gear it very specific to very specific causes like that. So it's very cool to see that.
I love that. Thank you, Matt. It's interesting, Dr. Matt and Tracy. If we can imagine we're nothing but a donut. If you look at the shape of a donut, there's three things I want to add to this that I think are really exciting. Our internal environment and our external environment, they're one connective sheath, myofascially speaking. And the only way it enters the bloodstream is through the small intestine. And so our skin, and like Dr. Matt was saying, our skin and our digestive system are intimately related. And actually in utero, the skin and the nervous system share the same neural tube. So really, our skin and nervous system are one and the same. So anytime Dr. Matt or I put needles in somebody, or Tracy does Toi Na, which she'll discuss later, which is an advanced form of Chinese medical massage, we're actually influencing the nervous system. And the second point is the spleen is the largest lymphatic organ in the body. So the Chinese empirically figured this out thousands of years ago, right? They called this spleen qi deficiency. In other words, the spleen's not working as well. Right? And what we're finding out in the research is when the spleen is strong, the immune system gets strong because the lymphatic system gets rid of all the toxins inside the body. And if we're toxically burdened, our mitochondria can't function very well, so our immune system becomes compromised. And the third thing I want to mention is the respiratory system. There's something known as nasal nitric oxide in our sinuses. And we're actually genetically engineered to breathe 100% from our nose. We're not meant to breathe from our mouth. We're only meant to eat and speak from our mouth. But genetically, 100% of our respiration should come from the nose. And we have these little hairs in our nose, right? Everybody's seen them, right? These hairs filter out toxins. Even viruses, bacteria, fungi, these little hairs protect us. And so if we're breathing from our mouth, all those fungi, bacteria, viruses, they actually enter the lungs directly versus indirectly through the nose. Now, every time we breathe from our nose, we're actually activating this molecule known as nitric oxide. And what they're finding now is that nitric oxide not only dilates blood vessels, which goes back to what Dr. Matt was talking about in circulation, so it's going to improve blood flow throughout the whole entire system, but it's also going to boost the immune system. It's kind of wonderful how the body now is being proved to work exactly how the Chinese medical doctors talked about thousands of years ago.
Since we talked about Dr. Evan, since you were talking about what not to eat, especially with, the holidays quickly approaching us, what would you recommend as more beneficial foods for people to have during that time, but during all seasons of the year to help boost their immune system?
There's 2 points to that. I love cheat meals. So don't get me wrong. I'm not going to tell you not to have cheat meals, right? I think that we're human beings and we love to enjoy foods. Now, we love to eat. I think that we need to have time-restricted eating. I think that plays a really critical role. So like intermittent fasting plays a big role. Like, for example, it was my wife and my anniversary 2 weeks ago. We ordered paella. We ordered sangria. I'm human, right? I don't cheat a lot, but when I do cheat, I go to town. I'll have my pizza every quarter, right? I love to eat. But what I do the next day is I fast the whole entire day. Now I'm creating a metabolic reset. I'm stabilizing my sugar levels. I call it the hormone triad. So we need to balance these three hormones. If we balance these three hormones, the immune system stays strong, the cardiovascular system stays strong, our fat loss and fat gain becomes neutral. We need to balance catecholamines. The catecholamines are adrenaline, noradrenaline, cortisol, etc. We need to balance insulin. And insulin goes up or down depending on the foods we eat. The glycemic index of foods, sugars in foods, as well as proteins, cause an up and down swing of insulin. And the third thing is melatonin, which is part of our sleep-wake cycles. They're all intimately connected. If we don't regulate and balance this hormone triad, our immune system's gonna be weak, we're gonna be overweight, we're gonna be more prone to diabetes, cardiovascular disease, and cancer.
So Dr. Matt, how would you add to that in terms of, from a Chinese medicine perspective, in terms of diet or supplementing the diet with herbs or what have you?
Yeah, there's a couple of things that we can do. I mean, traditionally, one of the most important things that in the Chinese dietary therapy is eating appropriate to the season also. So one of the issues that we have now is with all the accessibility to foods, or even if it's organic, from Argentina or Mexico or other places, you can get, for example, bananas any time of year. You can get strawberries any time of year, things like that. And as great as that is, it may not be appropriate for the season. So that's one way that we try to look at people to make sure they're eating a little bit more appropriate for the season. A lot of it is just keeping it simpler. Like Dr. Evans said, if you do let yourself go a little bit and you have a cheat meal, is to make sure that the next day or the next week or whatever, that you're back on a simpler a diet or simply your normal schedule. But, looking at things like, in the fall, eating more root vegetables, in the winter, eating more broths and soups and things like that. In the spring and summer, lightening it up a little bit. For the most part, we try to avoid anything too heavy, too dense, too sugary, too much flour, starchy, things like that. And we also try to avoid things that are too cold. All right. A little bit more in the summer is okay because it's hot. And we avoid in the winter, especially in the winter. In the summer, we tend to avoid the things that are a little bit more hot, right? Just to balance with the seasons. So that's something that's just in addition to what Dr. Evan was saying that we do. But we also have the Chinese herbs, which are really powerful. And we use those as our type of supplement too. It's when I mentioned before, the environment and the terrain and finding the balance within that. The acupuncture certainly does that, but the herbs can do that too, because you're taking it internally. And essentially that's what any supplement is doing, is balancing what needs to be balanced. So if there's a deficiency, you're going to add substance to it. If a person has an excess of something, you're going to try and add something else to create the balance between, whether it's, the elements, whether it's enzymes, whether it's amino acids, whether it's, nutrients. Or, in the case of Chinese medicine, just as an example, I have a few of them here in their bottles. For immunity, there's some really common herbs that people even know, and everyday things that we've been using for thousands of years that are really effective in creating that balance in the terrain. So as an example, some people have heard of astragalus, is a very common herb. Can't really see it, but that's huang qi. This is just the powdered form. That's a very common herb. It boosts that qi that we talked about before, that spleen qi and the lung qi, to help to offset some of the deficiencies. We have things like chrysanthemum flower. Everyone knows that. That's another great herb for immunity. Even certain types of ginseng are used for immunity too. People are very familiar with that. Cinnamon, just different Chinese names. It's called guizhi. It's a fantastic herb. Mint is used very commonly. So some of the most common things that people even know and they can go and get anywhere are just what have been used for centuries to help balance out the immunity. So that's another thing, another resource we have to add to the nutritional stuff that Dr. Evan was talking about.
Dr. Evan, since you've done like an extensive research in not only Chinese herbs, but also more the Western nutrition side of supplements, what supplements would you recommend for people? And also, how do you take your lens of the Chinese medicine aspect and integrate that into more of the Western side of nutrition, if you will?
That's a great question. And I just want to add one additional comment for sore throats. I mean, right now we're in the pandemic, so we're not treating any patients that are coming into the clinic with sore throats right now, but we can recommend herbs at home, right? So we could ship herbs to them anywhere in the country. But historically, if somebody came in with a cold or flu, there's points on the fingers, acupuncture points on the fingers. There's one here and one there that we would bleed. And by bleed, I mean we have a lancet, we bleed those points, we take a couple of drops of blood out. And it is almost like, Dr. Matt, you've seen this time and time again. Probably hundreds of cases come through our door previously where they've had horrific sore throats that are pretty much completely gone in minutes once we bleed those points. There was instances where my daughter had fevers and I would bleed the top of her ear and nothing worked for her fever. Tylenol, Advil did not bring it down. But the moment I bled the tip of her ears and I got just a couple of drops out, the fever went away. How simple that is, and how, if you've never been exposed to Chinese medicine, how impossible that is. People think it's a miracle, but we see it on a daily basis, right, Dr. Matt?
Yeah.
But right now, we're not taking any patients in the clinic that are sick, but we can recommend the herbs like Dr. Matt was saying. Now, as far as home therapeutics, home food that you could do, I'm a huge fan of liver. You know, vitamin A and food-based vitamin A is one of the most effective ways for us to boost our immune system. It's actually all the fat-soluble vitamins, vitamin A, D, E, and K, right? And what's beautiful is this: liver has more vitamin A than any other superfood on the planet, and liver is considered a superfood. And so we have all the fat-soluble vitamins are found in vitamin A. Cod liver has it, desiccated or cow liver has it. Any organ meats really are loaded full of the fat-soluble vitamins A, D, E, and K. And now I don't like the taste of liver, so we created a product called Vitametabolism that actually has liver and heart in there, and it's dried liver and dried heart. And what that does, it'll help boost the immune system. And that's one way to prevent it. A daily dose is about 5 pills per day. But if you're coming down with something, we've had patients that double that dosage and it reduces symptoms very, very quickly. You can actually open it up and eat it, and it doesn't taste too good unless you like liver, like my wife likes liver. Not a big fan of liver. But there's some other, bone broth is another food. I think Dr. I was talking about broths. Bone broth has been used, like chicken broth has been used for hundreds, if not thousands of years to treat the immune system. And part of it is because the minerals that are found in the bone broth, that's what boosts immune systems. Now there's something known as organotherapy, or pluriglandular therapy. That means that you're eating organs. And in Chinese medicine, we believe that likes cure likes. So if I eat a walnut that looks like a brain, it's going to improve my intelligence. If I eat liver, it's going to strengthen my liver. If I eat thymus gland, it's going to strengthen my thymus gland. If I eat spleen, it's going to strengthen my spleen. And so I would suggest we don't have spleen organs or thymus organs in our practice. We could buy those on Amazon, and you could get those really cheap on Amazon. Buy a good quality organ of the thymus and spleen. That's going to boost the immune system.
So you had mentioned vitamin D. How does vitamin D improve the immune system specifically?
All right, so vitamin D, not from cholesterol. Let's create a differentiator here. Vitamin D is not cholesterol. Cholesterol is what's sold in a pill form. I'm not a big fan of the pill form vitamin D, but I'm a huge fan of supporting vitamin D. So if I'm not a big fan of the pill form of vitamin D, cholesterol, right? Then where do we get our vitamin D from? The sun. All right. So when we go out into the sun, there's full spectrum lighting in the sun. So you get your UVA, UVB, we get the far infrared, the infrared, we get the blue rays rather. And it's the whole spectrum of the light. That's what actually optimizes the mitochondria, which are the powerhouse centers of the body. And there's 3,000, I think about 3,000 mitochondria per one cell, and there's trillions of cells. So we have enough electrical capacity in our body to start an engine of a car if we had that focus. And you guys being in Qigong for years, you've seen people be thrown around just by thought, right? And move the energy inside the body. So it's these powerhouses that we could actually biohack. And light therapy is one way to biohack. Intermittent fasting is another way to biohack. So what they found is when we intermittently fast, we create something known as autophagy, which boosts the natural killer cells in the body. And the body starts cleaning out old, dead debris. It fortifies the immune system. It kills old bacteria, old viruses, and fungi inside the body. Intermittent cold therapy, cold exposure. Now in Chinese medicine, we're not big fans of cold. So I love the aspect of intermittent cold therapy, but then you need to have your Chinese herbs after. Because Matt, if you could explain what wind chill is, that'd be awesome. So people understand there's a difference, there's like multiple differences between cold and flus. If you could explain that, I would love that, Dr. Matt.
Yeah, I'll try and do it as simply as possible. It does get a little technical, but in the simplest way, we study how the body responds or reacts to any type of environmental invasion, so to speak, whether it's bacterial or viral or any type of infection that can come in. And we look at, in sort of an analogous way, how the body responds is representative of what the characteristic of that pathology is. So we describe things being carried by the wind, for example, and that is in a sense a poetic way of just describing that things are communicable, so they get carried between people. So the Chinese describe that as a type of wind, meaning like bacteria, viruses, pollutants, allergens, things like that are carried via the wind and carried through the environment, whether it's lack of ventilation or whether it's coughing and sneezing on somebody. That is a type of wind according to the Chinese medicine. And then the response within the person is going to show whether they're more prone to cold or chill, as Dr. Evan mentioned, or heat. Okay, so a more vigorous type of fever, a high fever with a lot of sweating and a lot of thirst is going to be described as like a heat response. And then the more chills and body aches and headache and neck tension and lack of sweating is going to be described as more of a chill response. So what we're doing, again, part of that balance is just looking to see, okay, which one is the person presenting with? We know it's coming from outside. We know it's that wind as we describe it. And then we just have to decide, do they need more of like both need a push out, so to speak, because it's going to be a more on the surface level. We know the way the skin reacts when we feel sick. We know the pores get clogged. We know our nose gets all congested, and we have the head and the neck symptoms. So we want to, in a sense, have the bouncer from the club come and bust and throw out all the bad stuff. And so that chill is really just going to be responding more to warming or hot herbs. And then if we have more of a heat response, it's going to respond more to cooling herbs. So in a sense, for something that can be as complex as an immune response, the Chinese herbal therapy is actually very simple in the sense of identify the way the pattern looks. Where's it coming from? And then what herbs are going to apply best to that? So just as a quick example, like something like cinnamon is a warming herb, and it has that bouncer effect where it will push out. It's a mild effect. One of the other ones that most people are familiar with, and unfortunately we can't really use it anymore, is ephedra, which for thousands of years was one of the most common Chinese herbs. And it from Sudafed, right? That's where the name comes from. Sudafed is a pseudo-ephedra product, and people know that because they would use that when they were sick or get congested. Now ephedra is really powerful. Ephedra is like the bouncer who's like 6'7", 320 pounds solid muscle with 27 years martial arts experience. It kicks things out. But unfortunately it was used, mismanaged and used inappropriately by people who didn't have the right training. So now the FDA bans it. But we have tons of other herbs that we can use. And again, depending on whether it's warm or cold presentation, bust it out right away and people feel better immediately, sometimes within just taking the first dose of the herb, they already start to notice a big difference. So it's very cool.
Dr. Matt, that's why it's important for people to have herbal consults.
Right.
Right. And because it has to be customized. We can't just say, here, take this. Nutritional therapies, it could be across the board. right? Because every human being eats the same food. But when it comes down to herbal therapies, it has to be highly customized. And what we suggest is people meeting up with our master herbalist 2 times a month. And we've had people that are doing this on a monthly basis, and they go out the whole entire year. And that way we just prevent illness from even entering the system, right?
Yeah, there is a problem certainly with, first of all, the internet, and people going to places like GNC or, asking the person who works behind the counter there, oh, what's good for this? But what they're not, the person there working there doesn't know anything about the person's internal environment, right? And that's such a huge part of what we look at. So the customization of herbal formulas is so powerful because we can gauge something based on how the person presents and whether they have an internal condition also. So certainly somebody can have a chronic condition and then get sick on top of that. Or somebody can be otherwise generally really healthy, but still get sick. So all of those factors come into play when we create a formula. So although we're basing our judgment on a lot of classic formulas that have been used for a long time, it's the tweaking of the formula for the person that really makes a huge difference. And it can have a lock and a key effect for them if you get it right. And that's why it's important to have, regular consults and meet with somebody who has had the proper training, certainly.
Yeah, I mean, I remember when my daughter was sick or my son was sick, I would contact you and you would actually customize the formula. I never went to you got on the phone with me. You looked at my son. You said, okay, I think that he needs. So it could be done from a distance. That's what I'm saying.
Yeah, absolutely.
It could either be coming in person or it could be done in a distance. What's interesting is the reason why I held up my tea is because I do cold showers every morning. And in Chinese medicine, if we don't have a balance there, right? I know the medical benefits of a cold shower. It fortifies the immune system, produces more brown fat, which burns white fat, which is like the fats around the midsection. It increases metabolism. But the side effect is what Dr. Matt was talking about, was cold invasion inside the body. So immediately after I do that, I make sure I have some cinnamon in my tea or my coffee. I'll put some ginger in there as well, just to warm my insides up. And so when we're looking at and I think that's what Trace was talking about before, is how do I bridge that gap? Because there's a lot of information in the biohack science, right? Like keto, extremely important for boosting the immune system. Intermittent cold therapy, extremely important for boosting the immune system. Intermittent fasting, extremely important in boosting the immune system. But we also have to understand there's this feast-famine approach. So when I'm fasting, today's my fast day, I'm gonna do a 36-hour fast. Tomorrow's my feast day. And then I do carb loading on a weekend. So it's very cyclical to balance my hormones, right? It's not like this one shot fits all. That's what I'm getting at.
Being able to do a consult distance, because I think especially now with people that are still a little leery, they may be in the best of health, but they're still a little leery about coming into the office. I think it's really important for them to know that we have the capability to do that as well, so they don't have to feel like they're stuck inside and waiting for when it's a good time, and not realizing that worry and that thought process that they're going through could be weakening their immune system while they're even in the safety of their own home, that we can still reach out to them and be preemptive on, especially like the teachers that are going back to schools now, and or anything like first responders, or just anybody day to day. I mean, that just has a lot going on in their brain that, they can give us a call and we can do that consultation with them and help them out in any way, or their friends and family as well.
Yeah, I remember Dr. Matt created a formula, a COVID-19 formula that we got from the hospitals in China. Mm-hmm. And it's an immune boosting formula. And I remember there was probably 5 or 10 police officers that were taking it. So mm-hmm. It's very powerful stuff. And I know, going back to the GNC comment, people spend $200 to $300 a month going to GNC, buying supplements that I think Dr. Matt talked about, that this is what the internet said, so I'm going to start taking this, versus getting a customized program by people that studied it. I mean, I've been studying Chinese medicine since '94, so almost 30 years. I started studying it when I was in PT school. And same with you, Dr. Matt. It's been a long process. And I still study 2 hours a day of advanced biohacking just so that I could customize programs and simplify them in such a way that it's palatable.
Yeah. And one other thing I'll say, what Tracy brought up about the consults or speaking to people, they don't have to come in. One of the simplest things we can do also is teaching breathing exercises. It's so simple, and it goes to your point, Dr. Evan, about the nitric oxide that that is in the sinuses and in the nose. You're triggering through doing proper breathing exercises. You're triggering that connection between the lungs and the nose and the nitric oxide. And you also mentioned stimulating the mitochondria. And yeah, we have trillions and trillions of mitochondria throughout our body. Mitochondria is known as the respiratory powerhouse of the cell. It is the lungs of the cell. So when you do, focused breathing exercises, you're stimulating the power of the mitochondria throughout the whole body. And it's so simple. It's a couple of breathing exercises that you can do in 10 minutes a day, that I can teach anybody over the phone or in a face-to-face consult or on the computer. That really goes a long way in helping to regulate the immunity, but really empower the body through creating better energy and a better environment, through the lungs. And it's amazing how sometimes that simple stuff can go such a long way.
I love how you positioned the mitochondria. That was fantastic.
Yeah.
A little not known fact about the mitochondria: they're actually ancient bacteria.
Yeah.
So there's another bridge between the small intestine and the gut biome and the powerhouses of the cell. How fun is that?
And one more thing about that is what they don't, a lot of people never understood when the Chinese pair organs, the lungs are always paired with the large intestine. And a lot of people don't understand where that connection comes from. But when we talk about the mitochondria actually being an ancient form of bacteria, how did the Chinese, 1,000 years ago make that connection that we're just discovering with, modern technology through electron microscopes and stuff like that? There is a powerful connection between the gut health and the lungs too, in that balance that's created. It's really wild. And we try to take advantage of that and knowing that information. It's awesome.
I love that.
We've talked a lot about like the food aspect, nutrition, in terms of either things that could weaken our immune system or enhance it. So what other, I guess this question could actually be for both of you, what other lifestyle practices maybe that people don't recognize that they're doing because it's just become a norm that is actually detrimental to their immune system, and or the reverse, that they should do more of because that's actually promoting a healthy immune system?
Yeah, I can go ahead. It's a great question. Now, the first thing that popped into there's two things that popped into my head, and I know Dr. Evan touched upon it in terms of melatonin and sleep cycles. I think people are not giving enough respect to how their quality of sleep. Okay, so one of the things that does is, obviously that creates, stress hormones to be released into the body, and one of the things that weakens immunity is increased stress load. All right, you can have viral load. That's a topic that people are talking about now with COVID, in that there's a certain amount of load that your body can handle before the virus starts taking effect and causing wreaking its havoc. But it will do that in an environment that allows it to do that too. And one of the things that's going to allow it to do that is poor sleep quality. So you're not conserving energy the way you should, and then you're running an energy deficit throughout the day, and then that sort of creates a chain reaction. The other thing I would say too is we're electrical beings, and acupuncture works on the premise of electrical circuitry and communication between body parts and the cells and the organs and the brain and the central nervous system. And I think that, we're doing this on Zoom because we have to, but there's nothing wrong with that. But I think the amount of electronic interference may have an effect on the body. I think that people, in some ways, when they can, need to quiet their mind, and simplify, and occasionally put the computer away, put the phone away, don't sleep with it near you, that type of thing. Sometimes shut the TV off just to take the edge off, and not have so much of that, that load that your body, stress load, because it is a stress on the body that it has to deal with. So I think that's one of those hidden ones that people don't realize that actually can, possibly affect your overall environment and immunity. don't know if Dr. Evan has anything else you'd like to add.
I love that. I think that summates a lot of what we talk about and teach at Kinetic Rehab and Spine. And then blue light, I think that's just to piggyback on what you're saying. Making sure you have red light glasses or blue light blocking glasses. Get red. I don't have my red glasses, but about 30 minutes to 2 hours before you go to bed, put a red filter glasses on. You could buy them really cheap, 20, 30 bucks on Amazon. That'll prime the pump, prime the melatonin to be produced at night. So when melatonin goes up, growth hormone goes up. If growth hormone goes up, the immune system goes up. So we want to make sure that we're regulating sleep-wake cycles. And like you said, electronics are one of the primary culprits. I know for a fact when I have a lot of meetings via Zoom, I just get so anxious that it's gonna close everything and move. And we got to be mindful of that. If we start feeling a certain way, it's actually called psychoneuroimmunology. And so our thoughts create emotions, and our emotions create feelings. So if we have 60,000 plus thoughts per day coming inside, and 46,000, 200,000 of those thoughts are the same thoughts we had as yesterday, and they're negative. And then we need to be able to have strategies like breathing, like cold therapy. Because I don't know about you, if you've ever done ice therapy, can you think about any other stressor but that at that given time? Hell no, right? And same thing happens with fasting. Like when you go into like a 24-hour fast, you can't think about anything else but food. Your body prioritizes where your thoughts go. And cold, intermittent fasting, shallow, like deep breathing, but breathing from the nose in a nice tempo manner. I mean, your brain can't think about two stresses at the same time. And those are really interesting, amazing secrets that the Chinese have been using for thousands of years. As far as product line goes, I know we got to wrap it up. We have our Vita Sleep formula, which we sell a lot of. And what we found, like Dr. Matt was saying, with sleep-wake cycles and immune system, a couple formulas that I would highly suggest that you could take on a routine basis that are fortify the immune system, and then getting custom herbal formulas done by Dr. Han or Dr. Matt or even me. But Vita Sleep, extremely important in your sleep-wake cycles, number one. The Vita Metabolism, that's the one that has vitamin A, naturally occurring vitamin A, D, E, and K from bovine liver, cow liver. That's a great one to boost the immune system. Vita Repair, which we're ordered on right now, that's a very, very important one for regulating stress, regulating the sugar imbalances like insulin resistance and insulin sensitivity improves and boosts immune system. And Vita Omega. Those four formulas right now will, in our product line, will help boost the immune system. And the reason why Vita Omega is so powerful, it has a molecule known as carbon-60 in it, and it's the most powerful antioxidant on the planet.
Any last comments? Anything you want to leave our viewers with?
I think, we do this to educate people so that they get a clear picture of the natural way of regulating their immunity and boosting their health and providing the best resources we possibly can. So I would say that anybody who's watching this, just talk to us, ask questions. We love, obviously you can tell we love talking about it. And we have so much various experience among all our practitioners, and we have a lot of eyes that can look on you and give you some simple stuff. Like I said, this doesn't have to be overly complex. There are some very simple, easy steps that you can take that really go a long way. And all it takes, the only thing it really takes is just the effort to either come in or call and talk to us, and we get that ball rolling. And I think people are often surprised at how much of a difference it can make just instituting some simple changes. It doesn't have to be dramatic, life-changing events. It can be, something that you can get done in 10, 15 minutes a day, maybe 5 minutes a day. And maybe once you get that ball rolling a couple of times a month, talk to me, talk to Dr. Evan, talk to Dr. Han, and we just kind of keep you on the right track. And that really can make a huge difference as you get, especially as we get through the fall and winter, when we don't know what's going to happen with the COVID, if we're going to have a second wave, you know, when it overlaps with the flu season. We just really need to put in the effort to make sure that we're taking care of ourselves. And I don't think it's that difficult, you know, as long as we have a clear understanding of what we need.
Perfect. I think my perspective would be, in order for your health to change, you must change. All right, everything changes. So if we keep on staying consistent with who we've ever been and who we've always been, then our health is always going to be the same. And it's hard. It's not easy. Change is not easy. You know, do you think I like taking an ice bath at night, a cold shower in the morning, and fasting 3 times a week? I freaking hate it. But what I do know is that, according to the research, it extends my life expectancy. And if you know my story, my son passed away, and so did my wife, my first wife. And so I want to be around as long as I can for my children. And the only way for that to happen is if I change. I can't expect you out there, the world, to change for me. I must change first. And we welcome you guys to change. Let us coach you. Let us guide you. Let us build a community where we're serving and helping the world. Come join us. Schedule your consult today with one of us. It's a free consult. You have nothing to lose and everything to gain.